Welcome back to the deep dive. Today we're getting into something pretty specific, topical anesthesia in dentistry.
Yeah, we've got a couple of sets of lecture notes here. Same basic info, but we're going to try and, unpack it.
Exactly. Figure out what it is, how dentists actually use it, and, well, why it matters.
Yeah.
Cut through some of the jargon.
Make it make sense.
Okay, so first off, local anesthesia.
Hmm.
That's the big umbrella term, right? Applying something directly in the mouth.
Mm-hmm. And that covers both the topical stuff we're focusing on and the injections that provide that deeper numbing.
Right. So topical anesthesia, the main point seems to be it's just for the surface, the mucous membranes.
That's the key takeaway. It numbs the superficial layer. It won't really touch the tissues underneath. Big difference from an injection.
So, okay, if it only numbs the surface, why use it? I mean, what's the main benefit?
Well, the big one, and I think something, most people can relate to, is minimizing the pain from the needle stick itself.
Ah, okay.
Hmm.
Takes the edge off that initial pinch. Makes sense. A lot of people aren't fans of needles.
Definitely makes the start of the process, well, smoother. But that's not all. It has other uses, too.
Oh, like what?
Well, for one, it can help desensitize teeth if someone has, really sensitive spots.
Interesting.
And maybe surprisingly, it can also help reduce the gag reflex.
Really? How does that work?
If someone gags easily, say during dental impressions, a bit of topical on the palate can sometimes calm that reflex down, makes the procedure more tolerable.
Oh, that's actually pretty clever. Practical uses beyond just the needle thing.
Exactly.
Now, something in the notes jumped out at me, the concentration. It says topical anesthetics are way more concentrated, 20% to 50%.
Yeah, that often surprises people. It's much, much higher than the concentration in the local anesthetic that gets injected.
Why such a big difference?
Mm.
Seems counterintuitive.
Well, think about it. It has to work just by sitting on the surface. It doesn't get delivered deep into the tissues. So you need that higher concentration right there on the surface to actually penetrate that top layer effectively and give you the numbing effect.
Okay, that makes sense. It needs more punch because it's not getting injected directly where it needs to go deep down.
Precisely.
And it comes in different forms too, right? Gel, liquid.
Yep. Gel, liquid, ointment, even spray sometimes. Gives the dentist options depending on, the specific situation or area they need to numb.
So how do they actually apply it? Is it just slapped on?
No, there's a method. The notes lay it out pretty clearly. First, and this is crucial, review the patient's medical history.
Always step one. Safety first. Allergies, conditions, medications.
Absolutely. Can't skip that. Then they dry the area, usually with a little 2x2 gauze square.
Why dry it?
Good question. It's to stop saliva from immediately diluting the anesthetic.
Oh, right. You want that high concentration we talked about to actually work. Saliva would just wash it away or weaken it.
Exactly. Keeps it effective.
Okay, so check history, dry the spot. Then what?
Then apply just a small amount, usually with a cotton-tipped applicator, right onto the specific site where the injection will go or where the numbing is needed.
Just a small amount, not globbing it on.
Generally, yeah, you don't need a huge amount, just enough to cover the target area effectively for a short time.
Okay, seems pretty straightforward when you break it down.
It is, but each step has a reason.
So let's recap quickly. Topical anesthetic, surface numbing only, main goal, make needles less ouchy.
But also helps with sensitivity and gagging sometimes.
Comes in various forms,
Yep.
gels, liquids, etc. Much higher concentration than injectables. For good reason.
Yep, needs to work on contact.
And the application process, check history, dry the area, apply a small amount carefully. Simple steps, but logical.
That's the gist of it. It's a common procedure, but there's thought behind it.
It really shows how even these seemingly minor things in a dental visit aren't just random. There's pharmacology and technique involved, all aimed at patient comfort.
Absolutely. It's not just numbing goo. It's a specific tool used in a specific way.
So maybe a final thought for you listening. When was the last time you thought about the why behind some routine healthcare step?
Yeah, it makes you wonder, doesn't it? How many other common practices, maybe even outside of dentistry, have this level of detailed reasoning and specific technique that we just don't see on the surface? Things designed for our benefit that we might just take for granted. Something to think about.